Gastro-Oesophageal reflex are also called Reflex Oesophagitis. Etiology includes alcohol, cigarette smoking, pregnancy, obesity, ascites. The common effect of these three, it includes pregnancy, obesity, and ascites, includes increases intra-abdominal pressure. And other etiology, coffee. The coffee causes lower esophageal sphincter tone decreases. After treating achalasia, reflex increases. And the common mnemonic is ABN. ABN you can remember by CBN. CBN means Chandra Babu Naidu. C is replaced by the A. So ABN. ABN. A means anticholinergics, B means beta adrenergics, N means nitrates. This relaxes smooth muscle. And other mnemonic is H square, which is it is in heels, and H square, which is H means hiatus hernia. It means sliding hiatus hernia. Next, skin. It includes like a scleroderma. That it is the three conditions predisposes to the reflex esophagitis. In this mnemonic, CBN means Chandrababu Naidu. Chandrababu Naidu is the Chief Minister of Andhra Pradesh in 2024. It is C is replaced by the ABN. That's it. And the clinical features includes water brush, means salivation. Means salivation that stimulate that reflexes salivary gland, water brush. And suprasternal pain, heartburn, that increased by the bending and straining. Suprasternal pain and the heartburn is increased by the bending and the straining. And overweight. Next, the pharynx in the place of pharyngitis, in place of laryngitis, in place of esophagus, odinophagia or dysphagia. And the mucosal erosion in the esophagus wall that causes bleeding, hematemesis. And come this side includes tracheobronchial tree bronchitis condition. And in the larynx and the trachea, the symptoms includes choking, hoarseness of voice, chronic cough. These are the clinical features. Next, investigations includes due to the damage of the esophagus, so seen by the endoscopy. And movement of the esophagus by barium swallow plus with x-rays in the head down position. Next, test, the gold standard test. The star, it includes gold standard test. Gold standard test is 24 hours esophageal pH monitoring. So it is the investigations. Next, treatment part of reflex esophagitis includes the conservative treatment. Avoid smoking, weight reduction because of smoking is an etiology, weight reduction is a clinical feature, is overweight. So symptomatic treatment. And avoid taking food 3 hours prior sleep. Okay, because if during the sleep, if in case of food particles present in the stomach, it get reflexed. If food is eaten after immediate sleep. Next, acid neutralizing agents like antacids. Next, acid production inhibitory agents like proton pump inhibitors, H2 blockers. proton pump inhibitors and H2 blockers. Next, increased lower esophageal sphincter tone like mosapride, cinetapride, anti-reflex surgery, modified Nissen fundoplication. Okay, modified Nissen fundoplication. It is a treatment part. So, in a quick review, let's go to the summary of reflex esophagitis or gastroesophageal reflex. So, etiology: alcohol, cigarette smoking, pregnancy, obesity, ascites. Common effect is intra-abdominal pressure increased and coffee. Lower esophageal sphincter tone is decreased. After treating achalasia, reflex is increased. Next, similar to the Chandrababu Naidu, and C is replaced by the A. So ABN, anticholinergics, beta adrenergics, nitrates, and this causes relaxes the smooth muscles. Next, and high heels, HH means hiatus hernia, sliding hiatus hernia, and skin part, scleroderma. So these three conditions predispose to the reflex esophagitis. Next, clinical features. Clinical features includes water brush. Water brush means as usually salivation means that stimulates the salivary glands. Next is suprasternal pain and the heartburn. These suprasternal pain and the heartburn is increased by the bending and the straining. Next, overweight. So let's view on the respiratory system. Respiratory system parts includes the larynx that causes laryngitis, and next pharyngitis, esophagus, adenophagia, and next dysphagia. Next, esophageal wall that causes mucosal erosion causes bleeding and the hematemesis. Next, trachea part, tracheobronchial tree. Let's go to the tracheobronchial tree, bronchitis. Next, ear, larynx, tracheobronchial tree, choking, hoarseness of voice, chronic cough. Next, let's go to investigations. Investigation part includes like damage of the esophagus can be seen by the endoscopy. Next, movement of esophagus can be seen by the barium swallow with x-rays in the head down position. Next, gold standard test is a 24 hours esophageal pH monitoring. Next, treatment part. Let's go to the treatment part. Treatment part includes conservative treatment. Avoid smoking, weight reduction, avoid taking food 3 hours prior sleep. Next, acid neutralizing agents like antacids, acid production inhibitory agents like proton pump inhibitors, and next H2 receptor blockers. Next, lower esophageal sphincter tone is increased by the mosapride and cinetapride. Anti-reflex surgery includes modified Nissen fundoplication.